Hi there. This lecture is based on the nomenclature of the different neoplasms. So broadly, neoplasma tumors are classified into benign tumors and malignant tumors. And benign tumors are the those one which have an innocent behavior. It means that they are localized to their site and don't invade to the surrounding tissue and don't metastasize to the different distant sites. However, malignant tumors are those tumors which are aggressive in their behavior. They invade and destroy the surrounding structures, and they show a crab-like pattern. It means that they stick to the surrounding structures and invade them and destroy them. So malignant tumors are aggressive ones, while benign tumors are the innocent ones. And moreover, we should know here the parts of the tumor. Tumor basically have two parts. One is the parenchyma of tumor and other one is the stroma of tumor. So what is parenchyma? Parenchyma is basically cells that are comprising the main mass of the tumor, are the cell from which the tumor arises. So these cells formulate the parenchyma of tumor, and the characteristic of tumor are greatly defined by its parenchyma. While stroma is the surrounding cells as well as inflammatory response, or you can say when there is tumor, leukocytes accumulate there, and these leukocytes and inflammatory cells surrounding this tumor as well as blood vessels going in here and out, and other stroma here makes the stroma or the supporting tissue of the tumor. So tumor basically has two parts, one is parenchyma and other one is stroma. Parenchyma defines the actual characteristics of the tumor, while stroma is a supporting tissue which support the growth of the tumor. And the names of tumor mostly are derived from the cells making the parenchyma of the tumor. For example, in case of benign tumors, word OMA is added to the cell type which makes up the parenchyma. For example, if it is arising from fibroblast, then OMA is added to the fibro word and it comes about fibroma. And if it is arising from cartilage, then it becomes chondroblast. From chondroblast it becomes chondroma, and if it is arising from lipid cells, then it becomes lipoma. Okay, so word oma is added to the name of the cells which make up the parenchyma. In case of fibroblast, fibroma; chondroblast, chondroma; lipoblast, lipoma. Okay, and if a tumor shows or makes gland-like structure or has a glandular origin, then word adenoma is used. Okay, for example, if benign tumor is arising from pituitary gland, okay, and pituitary we know that is a glandular structure, then it will come about as pituitary adenoma due to its glandular structure. And if a tumor makes finger-like projection on a surface, then word papilloma is used. Papilloma is epithelial tumor which makes finger-like projection on a surface. And if a tumor makes finger-like projection inside mucosal surface, then word polyp is used. For example, colonic polyp or nasal polyp, you can say. Nasal polyp are basically inflammatory. However, they can also be of neoplastic origin. And sometimes a word, if a tumor arising in a hollow cystic organ, for example, in case of ovaries, word cystadenoma is used to show its cystic nature. However, this nomenclature is not generalized. There are many exceptions to this nomenclature, and all the tumor does not fit into this current nomenclature. So now we come toward the malignant tumors. So in case of malignant tumors, the tumors which arise from mesenchyme or have mesenchymal origin, word sarcoma is used with them. For example, having sarcoma is basically a bone tumor. Okay, and liposarcoma, if tumor arises from lipid or fat cells, then a lipoblast. In case of, if it is a benign tumor, then word lipoma is used, and if it is a malignant tumor, then liposarcoma is used. And if it is arise from skeletal muscle cell, then rhabdomyosarcoma word is used. If it is arise from cartilage, chondrosarcoma is used. Okay, so if benign tumor arises from chondroblast or cartilage, it is called chondroma. If a malignant tumor arises, it is called chondrosarcoma. Okay, and if benign tumor arises from lipid cell, it is called lipoma, and if malignant tumor arises from lipid cell, it is called liposarcoma. However, if a tumor is from epithelial origin, okay, tumor originating from epithelium are called carcinoma. For example, tumor arising from the skin include squamous cell carcinoma, basal cell carcinoma, okay, and they can be endometrial carcinomas and ovarian carcinomas and so on. However, in a very similar way, the tumors which make gland-like structures here are also called adenocarcinoma. For example, a tumor arising in the stomach is called gastric adenocarcinoma. Okay, and the tumor arising in colon is also labeled in the very similar way, and tumor which forms squamous cells is called squamous cell carcinoma. However, this classification is not so much simple. This nomenclature is not so much simple. There are tumors which does not follow these guidelines, and they are named accordingly. However, we move towards some special type of tumors which are called mixed tumors. Some type of tumors are called mixed tumors, and these tumors have multiple tissues in them. For example, pleomorphic adenoma. Pleomorphic adenoma of the salivary gland is an example here. This tumor has epithelial component as well as fibromoxide stroma. And moreover, another example here is teratoma. This is a tumor which arises from the teratoma is basically a tumor which arises from ovaries as well as testes, and it has component from all three germ layers, and the cell here produce different tissue component. For example, it can have bone, it can have cartilage component, it can have hairs, it can have epithelial component, so on. And we move toward some special terminologies here. One of them is hematoma, and other one is choristoma. Okay, so hematoma is basically disorganized epithelium inside a tissue. For example, a disorganized epithelium arising inside the liver is called hematoma. Disorganized epithelium of the liver is called hematoma, which arises inside the liver. It means that it is arising in the same tissue. However, if an epithelium arises in abnormal place, or tissue grows in its abnormal location, it is called choristoma. For example, if a pancreatic tissue grows inside the GI tract, it is called choristoma. Okay, and some tumors have we already have discussed that does not fit into this classification. For example, seminoma is a testicular tumor, seminoma, which does not fit into this classification. In the same way, dysgerminoma is an ovarian tumor of a female genital tract, and so on. So this classification is not general. There are many tumors which does not fit into this classification. Okay, so it is a general overview. Many tumors does not fit into this kind of classification, and you will find in the course of pathology that the nomenclature of the tumor is a complex thing which cannot be summarized in so easy and so small or summarized way. Thank you.